Earlier this week, a study was released showing that optical colonoscopy, a procedure in which a physician takes what is in effect a telescope and has a look inside the colon, is much less effective in finding cancers than had previously been thought. Virtual colonoscopies, which turn out to be very complete X-rays, have been picking up steam and backers in the medical community. Joining us now live in the Satellite Center, Dr. Dr Klein, who's a radiologist at the Washington Radiology Associates. I'm going to ask him about both of these procedures. Dr. Klein, thank you for joining us.
Thank you for inviting me, Dave.
What's your preference? Which should be done as sort of a general screening tool? Colonoscopies had been held out as kind of the gold standard for finding these polyps, these precancerous lesions inside the colon, and it looked like it was a very effective study. But a couple of studies now, this one that we talked about this week and an earlier study that showed they were having problems finding a certain kind of polyp, of lesion inside the colon wall, that maybe they aren't as good as we thought they were. What's your view?
Well, colonoscopies have been around for a long time, and we know that screening for colon cancer works. The question is, what's the best way to do it? The first question you asked me is, would I recommend a virtual colonoscopy or an optical colonoscopy? If we fast forward 3 years from now, I don't think we'll be having that same question posed. Meaning, I think the technology is such that we will see virtual colonoscopy replace optical colonoscopy for asymptomatic people, meaning people who don't have any symptoms, they're just screening for colon cancer.
Where do we stand right now with virtual colonoscopies being paid for by insurance? Because let's face it, that's sort of what drives these things very often now. There had been some reluctance to do it now. Are insurance companies recognizing the value of these scans?
Yes, they are. And in fact, several states, and three jurisdictions being Virginia, Maryland, and the District of Columbia, are now mandated by law to cover screening virtual colonoscopy, which was, by the way, recommended as a screening tool by the American Cancer Society and other medical organizations just this year. It's already for prime time. It's an excellent procedure. What it replaces being put to sleep and losing a day of work by instead lying on a CT scanner, which is a technique many people are already familiar with, and then having 2 scans, one generally on your stomach, one on your back. The entire procedure takes about 15 minutes. There's no sedation. It's completely safe and risk-free.
Dr. Klein, I'm afraid we're going to have to leave it there. We've run up against the tyranny of the clock. Thank you very much for joining us. I'd like to have you back, and we'll talk more about this. We'll step away for just a bit. Back with more news right after this.